Aloha. Hi, I'd like to welcome everyone here today. So thank you for joining us. And so today's presentation, we are talking about 5 surprising ways that natural medicine can improve your mood, treat depression, and reduce anxiety without drugs. So for those of you who aren't familiar with my background, I'm an ND, or a naturopathic doctor. And naturopathic doctors are trained as primary care physicians. We are trained in being able to do physical exams, order labs and interpret them, order imaging, and all the same kind of things that a regular primary care physician can do. We can also prescribe pharmaceutical medications when necessary, but our training is heavily focused on natural remedies. So doing a lot with diet, homeopathy, herbal medicine, and a number of other natural remedies. And so I do try to use natural medicines as much as possible in my practice. And I do also have a master's degree in Oriental medicine, which allows me to include Chinese medicine and acupuncture in my treatment protocols. And today I'm revealing 5 surprising ways that natural medicine can improve your mood, treat depression, and reduce anxiety without drugs. So please feel free to use the comment section to ask questions as the talk progresses. And at the end, I'll tell you how to arrange a no-charge phone consultation to talk with me personally about any health concerns that you may have. And also, just to note, if there are any types of topics that you think of as I go through the talk that you'd like to hear me talk about in the future, we'd love to hear that. Please put that in the comment section, and so that we can be able to think about the next Facebook Live topic that you would like to hear me talk about. So again, thank you to all of us for joining us. So to get started, one of the first ones that I want to mention in talking about mood and depression and anxiety is the gut. And some of you may have heard that the gut is our second brain. And the latest medical research has revealed that the lack of specific strains of certain good bacteria in our gut can lead to mood disturbances. But why is that? So many of you may not know that there are neurotransmitters or brain chemicals which control our mood, and most of them are actually made in the gut. So serotonin is one that's pretty well known, and a lot of common depression and anxiety medications will target serotonin. For example, Prozac is one that targets serotonin. And oftentimes in depression or anxiety, serotonin levels are too low. And so Prozac and other drugs are trying to help increase the levels of serotonin. But the question that I always ask is, well, why is it low in the first place? And serotonin can be low if there are imbalances in the gut, or if there's inflammation or other kinds of problems in the gut. And did you know that over 90% of serotonin is actually made in your gut? And so if you've got imbalances in your gut, be it not enough of the good bacteria or too much of certain bad bacteria or too much yeast or other kinds of things, then that can definitely cause problems with your mood. So just to give an example, so I've seen a number of individuals where they've come in and then they also they have concerns with their mood or anxiety or other kinds of things. But then they mention that, oh, as a side note, they have some gut issues. They might have chronic diarrhea or constipation, or they have abdominal pain or other kinds of things, or they have a lot of gas or bloating. Particularly if they eat certain foods, and that's not their main concern. It's not a huge problem for them, but then their main concern is their mood and other types of things. But sometimes those gut issues can be the underlying cause of mood disturbances, whether it be anxiety or depression. So just to give an example, I have a number of children and adults that I've seen in my practice where when we do testing, we find out, oh, they don't have enough of good bacteria that they need, and they need specific strains of certain probiotics. And a lot of people think that probiotics are just like a probiotic is a probiotic, the good bacteria, and you could just go to Long's or a local drugstore or wherever and just pick up a probiotic off the shelf. The one thing that you need to know is that not all probiotics are created equal. There's a lot of different strains, a lot of different species, and there are certain species that are really specific to the gut and to mood issues as well. I like to usually do testing so we can find out, okay, what strains does that person specifically need, or what are they lacking? Sometimes there are also problems with overgrowth of either good bacteria. There's a condition called SIBO, or small intestinal bacterial overgrowth, where there's an overgrowth or too much of your good bacteria. And then that can cause mood problems. That can also cause a lot of gut issues as well. And so I've seen a number of individuals that when we test them and we figure out, okay, this is what's going on with this person, and we work to correct that, either by giving certain strains of certain specific probiotics, or if they have a bacterial overgrowth, we address that with herbs or other types of medicines or diet or a number of types of things that we see their mood improving. And I've had people tell me, oh, yeah, since I changed my diet, like I just noticed, man, my mood is so much better. I feel so much better. And, if you have times where you're noticing, oh, you're snapping at your partner or your kids without any clear reason, or just kind of more moody in general, or also if you're more anxious or feeling down all the time without any clear reason, then we could certainly look to the gut. And I've seen sometimes where people have mood disturbances where they don't have any gut symptoms at all. They don't have any digestive symptoms. But then when we do testing, we can figure out what's the underlying cause. Another thing that's pretty interesting is that there's a certain type of yeast called Candida, which can be problematic. And if there's an overgrowth of Candida in your intestines, it produces a certain breakdown product called acetaldehyde. And that product is actually toxic to the brain. And acetaldehyde is the same breakdown product that you get from ethanol or alcohol. And acetaldehyde is the reason that when people drink too much alcohol and they get drunk, that they act not their usual self. So some people are happy, giddy drunks, silly drunks. Some are angry drunks. And it's because the acetaldehyde, which is the breakdown product from alcohol, is toxic to the brain. So it creates mood problems. Well, if someone has an overgrowth of Candida, that yeast, and there's too much of it, then they're also going to have a lot of this product, acetaldehyde, which is going to cause mood issues. And I've seen that a lot when people are either kind of like crying for no reason, or if they're kind of laughing and crying without any clear reason, kind of going back and forth, or I've seen it in children as well as adults, where their mood is just kind of off, or even in cases of bipolar disorder, where they definitely have gut issues. And sometimes there's issues with yeast overgrowth. And so when we address that either with natural methods or dietary things or pharmaceutical things, and we often will see their mood like this crazy crying or laughing for no reason, it often will just disappear. And so those are some other things. And hi, Greg. Hi, Orna. I see you guys. So great to see you guys. Thanks for joining in. So that's one thing, is the gut. And then also, did you know that there's research finding that stress can actually harm your gut health as much as junk food can? And so it's not just that your gut can cause problems with your mood and leaving you to feel more stressed, but stress itself can harm your gut. And that may manifest in people, for example, if they're really anxious or they're nervous, then they might have an upset stomach or diarrhea. But some people don't have a whole lot of gut symptoms, but the stress can impact your gut flora, the good bacteria, and a number of other things too. And so it's a two-way street, that your gut and your mood or your brain are really tied in closely together. And And I've also seen a number of people where their mood has improved a lot when they've taken certain food allergies or sensitivities out of their diet. So some of the most common ones that I see are things like dairy, gluten. Gluten is the protein that's in wheat, rye, barley, and in regular oats that are grown together with wheat. Also sometimes soy and corn. And I think it's pretty interesting that there are so many people that seem to be sensitive to gluten nowadays, even without celiac disease, even if they don't have abdominal pain or they don't have diarrhea, but they clearly have a sensitivity to gluten. And I've seen a number of children and adults that when they took gluten out of their diet, they started feeling a lot better with their mood. Some of them lost weight without even trying. And so I think it's pretty interesting. One of my personal thoughts about that is that I think some of the genetic modification is tied into that. I have mentioned this before in other Facebook Live talks, but a lot of our highly genetically modified foods, the main ones being wheat, corn, and soy, and there are other foods as well, but particularly wheat, corn, and soy are genetically modified to be Roundup ready. And that means that they're resistant to the herbicide Roundup. So what happens is that if it's not grown organically, if the wheat, corn, or soy is not grown organically, they're spraying huge amounts of Roundup on the fields, and then the wheat and the corn and the soy will live, but then the weeds will die. But the thing is that then we have large amounts of Roundup, which is an herbicide that's being ingested in non-organic wheat, corn, and soy. And that's it's not something that I would say is strongly validated by research studies, but that's a personal theory that I have in terms of why there's so many people who are sensitive to gluten nowadays that weren't before, or in times past we really didn't have this much gluten sensitivity in the past. So that's one kind of personal theory I have on that. Number two, so I'm talking about 5 different topics. Number 2, brain chemical imbalances. So that's probably not a big surprise to you, but there are a number of different things that I would like to elaborate on in terms of some of these brain chemical imbalances and where they could be coming from and ways that they can be treated. So there are brain chemicals called neurotransmitters that are highly linked to our mood. And those include things like serotonin and dopamine, epinephrine, norepinephrine. There's also a brain chemical called oxytocin. So a lot of the drugs that we have that work on anxiety and depression are treating and targeting serotonin and dopamine and sometimes some of the other neurotransmitters or brain chemicals. So again, it's not a surprise that those are linked to mood issues. But as I mentioned before, gut can be tied into all of those things because most of our neurotransmitters are made in the gut. One that people don't very often know about is oxytocin. So oxytocin is a natural feel-good hormone, and it makes us feel happy and relaxed. And the natural ways that our body makes oxytocin is through things like both sexual and non-sexual, affectionate touch, kissing, hugging, massage. Oxytocin is also released after orgasm from sex. And for women, oxytocin is also released during breastfeeding. So oxytocin is a really important hormone that is important in helping us to feel relaxed and happy and at ease. And a deficiency of that can lead to anxiety and particularly social anxiety. So social anxiety is when people have a lot of anxiety or nervousness about going out and being in public or being around other people. Sometimes it's with just being out in public in general. Sometimes it's an anxiety about being in large groups of people. Sometimes it can even be anxiety just meeting in a small group with people one-on-one, just talking to people. And so particularly anxiety or social anxiety can sometimes be related to a deficiency of oxytocin. So oxytocin can be stimulated by all of those things that I mentioned, affectionate touch, kissing, hugging, massage, sex, breastfeeding. But also oxytocin can be given supplementally, and it's made usually through special pharmacies called compounding pharmacies. But sometimes giving oxytocin can be very helpful, particularly when there's anxiety or social anxiety. One of the things that I wanted to talk about in terms of brain chemical imbalances is something called methylation. And methylation is a biochemical process that happens in a lot of different areas in our body. And methylation is really important because it's like a foundation. It's a foundation that you need. If you think of a building that has a foundation, you need a sturdy foundation for that building in order for that building to stand straight and not to topple over. And methylation is really important in regulating those brain chemicals. So methylation is the foundational process, and that has to be working normally in order for our body to make the neurotransmitters or to make the brain chemicals and also to break them down. And so there can be two problems when there are brain chemical imbalances. Sometimes your body is making too much or not making enough. And sometimes it's an issue with your body not being able to break it down quickly enough or breaking it down too quickly before it can actually act. And methylation is important for both of those. And if methylation is off, it's like a shaky foundation. And then what can happen is if your foundation is out of balance, if it's shaky, then your building is going to be crooked and then it can easily fall down, leading to the symptoms of moodiness and anxiety and depression. And I will tell you that I test methylation function. Hi, Lonnie. I see you. Thanks for joining. I can tell you that I test a number of my patients, almost every patient that I have, for methylation imbalances when they come in with moodiness or anxiety or depression, and almost 100% of them have methylation problems. So there are a number of ways. The good news is that we can treat that. We can treat that with a number of different vitamins and nutrients and minerals. So that really needs to be individualized for the person. There are also certain genetic mutations. There's something called MTHFR, and there's a number of other genetic mutations that affect methylation and that can cause brain chemical imbalances. So that's certainly something to look at as well. Also, I wanted to mention, so number 3, hormonal imbalances. So this can include things like imbalances in the thyroid and the adrenals, and particularly in women when there's an imbalance of estrogen and progesterone. So one of the things, an example that I want to bring up, I had a woman that came in and she was just super anxious. And it was kind of a sudden onset of this anxiety that was totally unexplained, came out of nowhere. And she was like, I don't know why I'm feeling anxious all the time. My heart's racing all the time. I don't understand why I'm feeling this way. And she's like, yeah, life is stressful, but there was not anything that happened all of a sudden that should make me feel like super anxious and my heart's racing all the time and all of these symptoms. So I checked her thyroid as well as a number of other things. And one thing that we found is that she had hyperthyroidism, and that her thyroid was too high functioning, and that was creating the anxiety that she was feeling. And so we basically worked to treat that. And then once that was treated, then we saw improvements, and her anxiety pretty much just went away. I had another woman that came in, and she was also feeling a lot of anxiety, and she had hypothyroidism or low thyroid function. But when I tested her thyroid hormones, and you usually have to do pretty extensive testing. Most conventional physicians will usually only test, they'll usually only do one test. Hi, Jeannie, I see you. Thanks for joining. Most conventional physicians will only do one test, which is called TSH, to check for thyroid. But typically, naturopathic physicians are usually checking for a much broader range of thyroid hormones. And her TSH was actually normal for that woman, but when we checked her other thyroid hormones, there was an imbalance, and it turned out that she was being overdosed on her thyroid medication. So we just reduced the dosage, and then her anxiety went away. So that's another thing that can happen in terms of anxiety. Or if people have low functioning thyroid, then they can tend to feel depressed a lot. And again, I see a number of people where they have a normal TSH, but when we test for thyroid antibodies, checking for autoimmune thyroid issues where your body is attacking your thyroid gland, or doing more thorough testing, we find that they do have a low functioning thyroid, even if the TSH is normal. So that's another thing that's important to get tested, and doing some thorough testing for that. Because I've seen a number of people who have come to me who have all the symptoms of low thyroid, and they say, well, you know, my doctor tested it, they said it's fine. And then I do more extensive testing, and then lo and behold, we find thyroid problems. So that can certainly be a contributing factor. Adrenals are another issue. If adrenals are too high functioning, people can tend to have more anxiety. If your adrenal function is too low, then people can tend to have a tendency more towards depression. And the thyroid and the adrenals do play in together. They're very closely linked. So testing both of them and doing thorough testing is important. Most conventional physicians often won't do tests for adrenal glands, or they'll just do one test instead of doing a more thorough test. Also, I see a number of women who have an imbalance of estrogen and progesterone, and particularly if they're feeling really moody just before their period or when their period starts, then that can definitely be a contributing factor to the moodiness if they've got PMS. And so that is often due to an imbalance of their hormones. So usually there's too much estrogen and not enough progesterone. And so when we address that, often I will usually use things like acupuncture and herbs, both Western and Chinese herbs, and we can often get that balanced. I'll often use homeopathic medicines, and that can often help to restore that balance. In addition, when women have too much estrogen, they can have a tendency to have really bad cramps. They might also have menstrual migraines, or menstrual headaches. They might feel really unusually tired, and they also have a tendency to things like fibroids or uterine fibroids. So hormonal imbalances can definitely be linked in to mood issues. And number 4, one of the things I wanted to mention that can also affect mood is vitamin D. So vitamin D is a vitamin that is actually also a hormone, and it's very important for your immune system. And vitamin D deficiency has been linked to things like cancer and Alzheimer's, but it's also been linked to depression, anxiety, to mood disorders like bipolar disorder. And vitamin D is also important in a mood because it affects your mood. And so if you have a vitamin D deficiency, then that can definitely affect your mood. I had one patient where we tested his vitamin D levels, and he had very low levels, extremely low levels of vitamin D. And we started him on a vitamin D supplement, and because he already did spend some time in the sun, and we started him on a vitamin D supplement, and then his mood and all of the symptoms that he was dealing with, the depression, it just kind of went back to, it just was gone, and it went back to his baseline level. It was pretty quick too. Within a few days of starting it, he really noticed a difference, and his family members noticed a difference as well, in terms of his mood and depression and things like that. And that happened a couple times where we found it was low. He wasn't taking it as often, and we tested again, it was low again. He started to feel a little moody, put him back on vitamin D, and then again, mood improved really quickly. So before your doctor puts you on an antidepressant, ask them to test for your vitamin D levels. And for vitamin D, also ask for a copy of lab results themselves, because most conventional physicians will look at the vitamin D levels, and the conventional normal reference range is about 30 to 100 nanograms per mil. And so most conventional physicians, if it's say like 32 or 34, then they'll say, oh, your vitamin D level is fine. But when you look at the research in terms of really the vitamin D levels that are optimal, then you really find that you really need levels closer to about 50 to 80 or so for you to have optimal vitamin D levels and function. So if you're working with a conventional physician, definitely ask for a copy of your lab results and don't just take it at face value. I've had way too many patients that have come in where they say, oh, my doctor tested my vitamin D, and then they're fine, and I request a copy of the lab results, and it's like 32, you know. So if it's like 30 or just above, it doesn't necessarily mean that it's optimal. So that, again, does need to be individualized. There are certain other conditions where you need to be a little bit cautious regarding vitamin D. So that does need to be individualized for your condition. And then the last thing that I wanted to mention, which is not too surprising, but a combination of things like meditation, exercise, yoga, and sleep, all of those things are super important. They're really basic kind of things, but they're really important for mood. And some of the things that we find, there's research finding that just spending more time outdoors has been found to help with depression. So if you can get exercise outside, outdoors, if you can get your bare feet onto the sand or onto the dirt or wherever you are, then that can be helpful. Just spending time outdoors in nature can be really helpful. And spending time outdoors also is a natural way that you're exposed to vitamin D too, is through the sun. But, you know, in terms of some of these other things, so for example, meditation is something that's been found to be really, really helpful for mood disturbances, anxiety, depression. And I would say that in the long term, that's really one of the biggest things that I've seen help patients with anxiety and depression in the long term. There are supplements or other kinds of things that may help quicker in the short term, but in the long term, I find that meditation is really important and really helpful. And meditation doesn't have to be oming for an hour in the middle of nowhere, sitting in lotus position. Meditation can just be as simple as doing some deep breathing, lying in your bed before you go to sleep at night. There are a number of different apps now and websites that offer free guided meditations. I often recommend the UCLA Meditation Research Center as a starting point if you've never had any experience with meditation, particularly if you've tried meditation and you feel like your mind just kind of tends to wander and you just find yourself thinking about what you're going to eat for dinner tonight, or you're stressed about, you know, some things with work or your family or whatever it is, and you have a hard time emptying your mind, then some of the things that are important are really just being able to have a guided meditation when you're first starting out. So if there's something that you can listen to, it's not just silent, and that you can have something where you're just listening, and it can be able to help you start that process of doing some type of meditation. And I mentioned the UCLA Meditation Research Center because they have a number of free not apps, but they have a number of free guided meditations on their website that are non-religious and that you can listen to. That I think is a really good starting point if you've never done meditation before. Some of them are really short. Some of them are just 3 minutes. Some of them are longer, like 19 minutes. But that can be really helpful for starting out. Also, these are not as surprising, but exercise, yoga, sleep, all of those are really, really important in terms of your mood. Exercise is really important because it gets the blood flowing to all the different areas of the body. And so those are some things that are really important to helping. Also, yoga can be helpful. And then getting enough sleep is really important too. because sleep, when you're chronically sleep deprived, that can definitely be a risk factor for mood disturbances, including anxiety and depression. Chronic sleep deprivation is also a risk factor for cancer, for autoimmune disease, and for a number of other things. So sleep is really important too. So those are just some, number 5 is just those lifestyle factors that are really important in terms of looking at mood and anxiety. And almost all of us can improve in some of those areas, be it meditation or exercise or sleep. So those are the 5 areas that I wanted to mention. Thank you for joining us. And so I trust that you learned something new and helpful about natural medicine, how it can help to improve your mood, treat depression, reduce anxiety, and all without drugs. So if you'd like to arrange a personal no-charge phone consultation, it's really easy. Just call our office at 808-783-0361. You'll also find our contact information on our Facebook page. And again, if you have ideas about things that you want to hear me talk about in this presentation, hi Vera, I see you joined. Thanks for coming. But yeah, if there are things, oh Aisha, I see you, hi. And then Fola Liana, thanks for joining as well. So if you have things that you want to hear me talk about in a future Facebook Live, or if there are things that I mentioned today that got your brain thinking about other things you'd like to hear us talk about in the future, please put that in our comments, and we'd love to hear what you'd like to hear us talk about at the next Facebook Live. So again, thank you, and thanks for joining us. See you in 2 weeks. Aloha.